Welcome back to the news today. Now to what researchers are hailing as a major breakthrough in a treatment of cancer. Immunotherapy is a new technique which trains the body to attack and destroy tumors. Experts are calling it the biggest step towards since chemotherapy and say it could save tens of thousands of lives per year. The treatment is specifically effective against some of the deadliest types of diseases, including lung and skin cancer. And right now, joining me here on set is Professor Ilan Ron, Chief Physician on Oncology at Tel Aviv Medical Center. Good evening. Thank you very much for coming. What is so amazing in this specific research that actually maybe can be this big breakthrough, like you're saying?
Well, it's in a way, it's a change of concept. As you said before, chemotherapy, it's like to bring a toxic item to the body, something which the body doesn't recognize, and kills everything that actually divides itself, and that's what it does. So it works on cancer cells as well on normal cells. Now we're talking about immunotherapy. What does it mean, immunotherapy? In a way, what we do by giving this type of treatment, we activate the immune system. The system which actually keeps us against all type of diseases and keep us in this way to attack the cancer cells. And on the other hand, and that's the idea of this specific treatment, it inhibits the cancer cells to defend themselves against the treatments. So we are actually attacking the cancer or the tumor cells from both ways, by the immune system that tries to kill, and it inhibits the cancer cells to try to work and to stop the immune system from working, from recognizing the immune system. That's the idea behind it.
You know, chemotherapy is a really hard therapy. We know all the consequences that come after chemotherapy. What is specifically maybe the good side or the bad side of this treatment?
Actually, there are not so many bad sides. The bad side is one, that the patient has this cancer, this horrible disease. That's the bad side. But the idea is, again, that actually we are trying to activate things and organs that inside our body against, specifically and selectively against the tumor cells. And that's the idea. So actually the side effects or the toxicity, what we call in common words, is not a major problem as we do. And as you said before, there are so many types of tumors which actually they don't respond to the chemotherapy. Okay. And you mentioned, for example, the skin cancer, and actually we try to direct ourselves to malignant melanoma. Malignant melanoma, it is a disaster due to a very aggressive tumor that actually at the era of the chemotherapy, only about 6% of the people responded to the treatment.
You know, again, I will ask you something else that we know about cancer, that maybe one of the key cures of cancer is to detect it on time. Is it also in this treatment? Is the time factor a factor in this treatment?
What do you mean? Can you just try to
actually find cancer on time, not in a specific
that's
level,
right.
Like in the third, fourth level?
Absolutely. That's right for everything. But what is important in this case is that we are dealing with patients who have metastatic tumors, that the tumor actually spread all over, and still we have quite a high response rate. For about 60% of the patients who are exposed to this type of treatment, and they do respond to the treatment, as opposed to the chemotherapy that is just 6%.
Wow.
And if we spoke about, I mean, years ago when we gave our patients chemotherapy treatment, they survived for weeks to just few months. When we are talking about this type of treatment, we're talking about with years.
Wow.
For these extended tumors, and that's a real revolution. Last word.
Just one last word.
Okay, sorry. This type of treatment is not just for skin cancer. It's for a very major problem. It's for a lung cancer, which is just running behind the skin cancer, and there are many more tumors to run and to go.
So this is, like you said, big, huge news for everybody who are who are sick in this horrible disease. Thank you very, very much for
Thank you
coming
to
to our
you
studio.
too.